Tristan Sovereign died during what's called a therapeutic restraint, a procedure like these which we recorded with a hidden camera in another charter hospital. But long before Tristan arrived there, some of the staff at Charter Greensboro felt the hospital was not keeping its patients safe.
Were you ever concerned that someone might get hurt during one of these restraints?
People did get hurt during seclusion and restraint.
Terrence Johnson had already spent 6 weeks working at Charter Pines and wearing a hidden camera when one night he got a call from the lobby. Terrence found himself in a crisis with a patient he knew nothing about and no other staff to help him.
She's scared. She sees this big man 2 or 3 times the size she is, and I'm there to take her upstairs.
If one person had said, "Stop, we can't do this," then my son might be alive.
I'm Ed Bradley. Our investigation of charter hospitals and some significant new developments in this edition of 60 Minutes 2. More than a year ago, we heard a strange story about a boy who just died in Greensboro, North Carolina. He died at the charter hospital there in the hands of employees who said they were trying to keep him safe. We investigated, and what we found led us far beyond the story of one child's death. It led us to Charter Behavioral Health Systems, the nation's largest chain of psychiatric hospitals. During a year-long investigation, we found evidence of injuries, deaths, and cover-ups in charter hospitals from Massachusetts to California. We broadcast these findings 2 months ago, and since then, dramatic changes have taken place at a number of charter hospitals. We'll tell you about those developments later, but our story begins at a charter facility in Greensboro, North Carolina, where one night about a year ago, something went terribly wrong.
Emergency 911, yes, we need emergency services at Charter Hospital, paramedic immediately. Charter Hill? Yes. Okay.
Phone call came in at about 10:30, and the voice said, "Tristan got very upset tonight and he stopped breathing, and perhaps you need to go to the hospital."
Early last spring, Jean Allen checked her 16-year-old son Tristan Sovereign into Charter Greensboro. When he checked in, he was severely depressed. 1 week later, charter staff thought he might hurt himself and tried to strap him to a bed.
Did anyone say that he died while they were trying to restrain him?
No. I called the police department the next day, and in talking with an officer there, he said, "Well, we have the towel." And I went, "What towel?" And he said the towel they had around his face. And I wasn't prepared for that.
According to state reports, charter staff wrapped a towel and then a sheet around Tristan's mouth that night to keep him from biting. Tristan was asphyxiated.
So he's face down and he's got this against his
Yes.
mouth. What they did was not standard procedure.
It was standard procedure in their facility, according to them. They said they used this technique very frequently.
An ordinary outburst ended in a patient's death. That's very troubling to me.
Idell Pierce has been the state of North Carolina's advocate for mentally ill patients for 13 years. But she says she's never seen anyone handle a patient the way Charter handled Tristan Sovereign.
In its official statement to you, Charter Hospital says that the procedures that they used to restrain Tristan were safe and effective. Is that what you found in your investigation?
We did not find them to be safe, and effectiveness should mean that the patient lived to learn from his experience.
Tristan Sovereign died during what's called a therapeutic restraint, a procedure like these which we recorded with a hidden camera in another charter hospital. During a restraint, a patient's wrists and ankles may be locked into leather cuffs and then strapped to a bed. Public records show that Tristan was the third patient in 4 months to die while being restrained in a charter hospital.
With nearly 100 facilities in 34 states, Charter is the largest, most comprehensive mental health care system in America.
Charter is the giant of the nation's mental health business, admitting about 120,000 patients a year. 35,000 of them are children and adolescents.
When something's wrong with your child or teenager, Charter is here to help.
Children may be sent to Charter if they are depressed or run away from home or use drugs or get into fights. Tristan Sovereign was suicidal, and a psychiatrist sent him to Charter for his own protection. But long before Tristan arrived there, some of the staff at Charter Greensboro felt the hospital was not keeping its patients safe.
When I stopped working there, that was part of the reason. It didn't feel safe to me. If it's not safe to me, it's not safe to them.
Leslie Armanox was an administrator at Charter Greensboro and a therapist there for 14 years. She says Charter lowered its standards constantly until she quit in 1995.
It got more chaotic, and there were regular kinds of incidents. Physical injuries, arguments between patients, and violent outbursts and things like that.
Were you ever concerned that someone might get hurt during one of these restraints?
People did get hurt during seclusion and restraint.
In Greensboro, the state found that Charter had been restraining patients in a dangerous, abusive manner for years. State regulators imposed an outside monitor on the hospital and now say they think Charter Greensboro has addressed its problems. But in the years since Tristan Sovereign's death, we've found that Charter's problems extend far beyond Greensboro. Across the country, we've met Charter patients who were injured by hospital workers and Charter employees who feared for their own safety. But the only way to see what really happens in a hospital is to work there. So we found someone qualified to do that. Terrence Johnson is a licensed social worker with a master's degree from the University of Pennsylvania. We asked him to wear a camera hidden in a pair of eyeglasses, scale back his resume, and apply for a low-level job at Charter Pines in Charlotte, North Carolina. He got a job on the children's ward.
When they hired you as a mental health technician, how long was your interview?
Probably about 5 minutes or so.
Did you have any kind of orientation sessions where you went to classes or anything?
No, it was sort of haphazard kind of learn as you go kind of thing.
When he started work at Charter Pines, Terrence Johnson got some advice from other low-level employees.
You're new, you know what I mean? So you're still more caring, you know what I mean? Compared to like some of the other staff who's been here long and they don't tolerate that kind of behavior from the kids.
And although all the workers Terrence met had at least some college education, many told him they had not had a single day of training.
There's no training. Like, I didn't get any kind of orientation per se. You know what I mean? It's just, okay, well, you're working with us now.
They're wanting you to catch on quick. Orientation is supposed to get over with. It's like that.
I'll tell you right now, I haven't been in not one training class since I don't even know what an Empire Exchange is.
That'd be some kind of orientation for new techs.
No, I haven't experienced any.
I know, but I mean, like, they should start something. Something.
What Terrence Johnson found in Charlotte was a familiar story at Charter Greensboro, according to Leslie Armanox.
Did you ever tell them that you felt some of the people you saw working, some of the people you worked with, were unqualified?
Yes.
And they said?
Sometimes the response I would get was, well, I don't know what else we're supposed to do. We're bringing in who we can bring in. And I really think they were. I think they were very creative in how they tried to solve problems about staffing. And I think these were good people, you know, who worked there.
They just weren't trained and they weren't qualified.
Not all of them were.
Could Charter say that, sure, we have mental health technicians who aren't well trained, but they really don't have to be? They're supervised by nurses and doctors in everything that they do.
The mental health technician spends the majority of the day along with the kids without any supervision at all.
I have no idea, like, what numbers to call. I know 911 is the only thing I can think of.
Everything's going okay?
You have to do notes every day on a number of the children, and the notes would have psychological terms on it, and you're doing assessments of these children, which go in their mental health record, and they give you no training for it.
So did anyone define these terms to you?
No.
Did you ask the nurse what they meant?
I asked the nurse, and she didn't know what they meant.
I go by this. I get my vocabulary words, my
psychiatric vocabulary words from
Oh,
here.
that's what I need to go do.
And I really need to make a list of.
So this nurse is your supervisor? She's training you on these psychiatric assessments for these children's charts?
Find out exactly what this is.
She gives you a list of words and she says she needs to get a dictionary and go home and look up to see what they mean?
Yes.
How much time do the nurses spend with the kids before they do these evaluations?
On average, no time at all.
You talk to him. How long do you talk to him?
Less than a minute.
Less than a minute.
The supervising nurse told me that you're supposed to find some negative behavior for the kid. Try to find something, she said.
Even if there's nothing negative there?
No, even if there's nothing, she said it's something you can find.
So I'll say patient displayed. That's how my opening is always a classic. Patient displayed. He's sort of, what do you think? You think he's,
I thought, I've interacted with him a lot, and I thought he's always appropriate.
let's say, but under behavior, what's some good words in here? He's not negative. He's sort of intrusive a little bit.
Not really.
He doesn't push limits anymore.
He didn't really act intrusive.
He acts sort of anxious.
But this isn't done for therapeutic purposes?
No, it was done for insurance purposes.
Insurance purposes meaning?
So that the hospital can get paid.
Focus on the negative.
And why should we focus on the negative?
Because that's how they get paid. I mean, this is what they told me. I mean, you write what you want to write. I know I got to write for it. So I know what I have to write. You know what I mean? So that's why
Like, why do you have to write it?
So this place can get paid.
Oh, okay.
It's a business thing. It's not like I'm lying, but I always like pull the negative out. Like
You're supposed to. They tell you to.
What? The negative?
Pull the negative out.
You pull it out of them.
When you write things about people, focus on the problems that they continue to have and their symptoms, rather than saying making good progress toward this or that, and focus on the negative.
And why would you want to do that?
So that it would look like, sounds awful, but so that it would look like the person still needed to be in the hospital.
What would you say if Charter says, that's not a hospital policy, that's something that low-level employees did on their own?
I don't know if it was actually a written policy, but I know that it was part of our in-service training.
They taught you how to do that?
Mm-hmm.
The treatment team or whatever that overlooks all this, they were like, don't write all this excellent stuff about them in their charts, because then they're like, well, why is this kid even here, and get him out of here.
That's a pretty appalling situation. I truly would not expect to find anything like this in any legitimate care facility.
June Gibbs Brown is the Inspector General of the United States Department of Health and Human Services, the nation's highest authority on healthcare fraud. Together with the Department of Justice, her office has taken action against charter hospitals in Orlando, Florida, and Westbrook, Virginia. We showed her the tape that Terrence Johnson shot in Charlotte. Could the hospital say that we train people to look for negative things because that's being on the safe side?
Well, something like this, I don't think that could be considered creating a valid medical record at all. It could be falsification of records. This individual didn't even seem to know the meaning of the words that she was selecting.
I mean, is that fraud?
I would say that was certainly fraudulent entries on that medical record.
We wrote several letters to Charter citing evidence of falsified records, unqualified staff, and dangerous practices in their hospitals. We also asked them for an interview. They sent us a letter stating that they could not respond to these allegations until they had investigated them. We will take appropriate disciplinary actions, including termination, if such conduct is discovered and made known to management. Charter's mission is to combine compassion with the highest quality of comprehensive care, with an emphasis on respect and dignity for all of our patients. The children at charter hospitals need the highest quality of care. Many take medications that can make their heart race or their breathing difficult, and those children must be monitored around the clock.
Yeah, I never been shown 100 years.
When Terrence Johnson was asked to take a child's blood pressure, he told his supervisor he didn't know how.
Okay.
And got a 1-minute lesson from this nurse.
That's where you're hearing the pulse, okay? So you want this to be this right here.
The mental health technician often don't really know how to do blood pressures and pulses properly.
All right, I'm off to do the
So it's common that they would get the wrong results.
And when another technician recorded abnormal results, Terrence Johnson's supervisor showed him what she would do about it.
These vital signs are all respiration's 40, somebody's hyperventilating.
She noticed that the vital signs for this person were extremely high, and so she scratched out what she thought was wrong.
Okay, 5 minutes, I'll begin.
And she replaced it with what she thought it should be.
She probably did it subconsciously.
She changed that vital sign, his respiration rate, without checking the child to see if it indeed had changed.
Yes, she did.
So she just basically made it up.
Yes.
But then I'm going to put retook in.
Did she say why she wrote that she rechecked the child?
So that she can cover herself.
Cover my child.
What do you mean cover yourself?
Because I'm signing these, see? What? I'm signing my name after all.
Based on what's on the tape, it's obvious falsification of medical records and patient endangerment.
So this is not just sloppy record keeping.
No, it's far more than that. And there could be a condition there that is life-threatening, and rather than check the patient, would you just change the medical records? Totally unacceptable.
Unacceptable, but not so surprising. Leslie Armanock says at Charter Greensboro, her supervisors asked her to write notes about patients she'd never met.
I just refused to write the note.
And why didn't you want to write the note?
Because I didn't know them, or 6 months might have lapsed, or a year or 2 years, and I didn't know the patient. And that's irresponsible.
You said that you saw Charter move some of his charts off-site before inspection dates?
I saw several boxes that were going to off-site storage.
Why would they do that?
Certain charts, maybe, if they weren't very good charts, they would go somewhere.
Where they wouldn't be seen? Charts were just moved and hidden?
A lot was done before they came in. Everything from physical improvements and decorating to moving charts and having people work overtime to complete them.
But did you have any doubt about what they were asking you to do? I mean, it was clear that this was fraudulent.
Yeah. And, I told them that.
At these hospitals, you have taxpayers who are footing the bill.
Yes, absolutely.
What you saw here, acceptable Medicare, Medicaid standards?
Absolutely not.
Last year, charter hospitals took in more than $300 million of taxpayer money from federal programs. That's about half their income. Meanwhile, the Inspector General has launched a system-wide investigation of charter's practices, including one of the most dangerous practices in any psychiatric hospital.
Open the door!
Restraining a child. We'll return in a moment. When most families come to a charter hospital, they are distraught and seeking counseling. But some patients may be admitted there before a charter doctor ever sees them. During our investigation, we spoke to families who'd had a frightening lesson in how that can happen, with their permission or without it.
Wrap them together.
Last year, just after Christmas, 15-year-old Crystal Leach was in what her parents Sherry and Benny considered an adolescent crisis. Crystal had written a note that mentioned suicide and made what could have been a suicidal gesture, 2 razor scratches on her wrist. Sherry immediately took Crystal to a counselor who referred them to Charter Greensboro for a possible admission. But all the Leaches wanted was some counseling.
And what happened when you got out there?
She just gave me like this 5 or 10 minute survey, and she talked to my mom, and then they came back and said that I was going to have to stay.
After they talked to Crystal, when they came in, the first thing they said was, "You're lucky we have a bed." And I told them I don't need a bed. She doesn't need a bed. That's not what we were there for.
What did you say when they told you had to stay?
Say that on TV.
I told them I wasn't going to, and I don't even remember everything, because the way she said it, it didn't seem like she cared what I wanted to do. She was just like, "You're going to have to stay."
Why didn't you just walk out with her?
Well, they had already told us that if we left with her, they would call the police, they would come to our house, handcuff her. Those were their words. They would handcuff her, and then they would take her out, and then the state would decide where to send her, and that she could be sent anywhere in the state to any facility.
Based on its screening interview with Crystal, Charter determined that she should be admitted for her own safety. The hospital got a court order to commit Crystal over the objections of her parents.
When you made that decision to leave her there, what are you thinking when you drive away?
I felt like I should go back and kick butt and let them know they weren't going to do that to me and my family. But I didn't truthfully know what they could and could not legally do.
We can't say whether Crystal needed to be hospitalized, but even after she was admitted, she says the counseling she got at Charter didn't amount to much. About a half hour of family therapy and 2 quick exchanges with her Charter psychiatrist.
So you speak to him the first day?
Yeah, for like 5 minutes.
The second day?
He wasn't there.
Third day?
He wasn't there.
Fourth day?
He asked me a couple questions and just signed me out.
While Crystal's psychiatrist was gone, another doctor wrote 2 brief notes on her file. Crystal says she never met another doctor and has no idea who that was. Terrence Johnson found that there was no consistent standard either for admission or for treatment at Charter Pines. One night after Terrence had already spent 6 weeks working there and wearing a hidden camera, he got a call from the lobby. A teenage girl was being admitted by her parents, perhaps on the advice of an outside professional, but nobody had told the girl. Terrence recorded the scene. We have altered the girl's voice and image to conceal her identity.
What did you see when you got to the lobby?
Everything was calm.
Up to this point, she didn't know she was being admitted.
No, she had no idea what was happening to her.
Then what happened?
At the elevators, the young lady asked, "Where are you taking me?" And everybody froze.
Terrence found himself in a crisis with a patient he knew nothing about and no other staff to help him. And he still had not been trained.
She's scared. She sees this big man, I'm 2 or 3 times the size she is, and I'm there to take her upstairs.
Then what happened?
She starts to scream, and they call her Dr. Strong.
Dr. Strong is a code that alerts everybody in the hospital, we need some help here.
We need some help.
It's a high-risk procedure to restrain an out-of-control child, and not just for the child, for the staff as well.
Dr. David Fassler chairs the American Psychiatric Association's Committee on Children. Dr. Linda Fink was last year's president of the Association of Child and Adolescent Psychiatric Nurses. We showed both of them the tape that Terrence Johnson shot at Charter Pines.
Do you need to explain what's going on here? Or do you just go in and say, surprise?
Well, in some cases, you may not be able to get the child there if you explain ahead of time, but once you get there, then absolutely. The child should know what's going to happen to them, be a part of planning what's going to happen to them. That's a dangerous situation. Carrying her like this, with her
sort of
flailing all around, she could get injured very easily.
But from their point of view, the staff, they arrive in the lobby, somebody says, hey, come quick. So they get there, they find a hysterical girl in the lobby. What choice do they have but to pick her up and carry her away?
They haven't tried standing her up and walking her to where they're going. They've sort of moved right away to deciding that she needs to be carried.
And no one's told her what they're really going to do. She doesn't know what's ahead of her. Where are they carrying her? What are they going to do to her?
She's immediately taken upstairs and locked into a bed where her arms are locked in and her legs are locked in.
Strap her down.
Strap her down.
Do they have any choice but to restrain her at this point?
Sure, they have a choice. No one's tried talking to her.
And she hasn't done anything dangerous.
She made a lot of noise.
Right.
They didn't know why she was there. The nurse was like, we just had to go get her and bring her up without any idea why she was there.
If the girl had a medical file at Charter, no one could find it while she was in restraints.
I haven't seen any paperwork or anything. What are we looking for?
That girl that we put in seclusion.
Did she ever get orders for the patient, or for her yet?
No.
The nurse spent nearly 40 minutes trying to figure out who her doctor was.
So without a doctor's observation, without a doctor's diagnosis, without a doctor's order, she's put in restraints and kept in that hospital against her will?
Yes.
I feel so bad for that kid, man.
I don't know what she's done or whatever. It's just, I mean, just weird to see that.
Oh, you haven't seen anything?
You seen worse?
Oh, yeah.
While Terrence Johnson was working in Charlotte, we spoke to dozens of charter employees around the country. We repeatedly found evidence of the same conditions Terrence found. The staff was untrained, the wards were often unsafe, and sometimes patients got hurt.
It was always a concern that something was going to happen because we didn't have trained personnel.
James Lell was the administrator of an adolescent unit at Charter Terre Haute in Indiana, and one of several former charter employees that we brought together from around the country.
Did they get training in CPR, for example?
One time in 3.5 years.
Training in restraints?
None. Never.
Training in counseling?
No. No.
Carol Farrell was a nurse at Charter Louisville in Kentucky.
They only staffed with one RN at night.
You worked alone?
Yes.
How many children on the unit?
At one time, we had 19 children on a 14-bed unit.
And there wouldn't be enough people in the building on the night shift to safely restrain a patient.
Charles Bellinger was a nurse at Charter Pembroke in Massachusetts. In the last year and a half at Charter Pembroke, a patient died in restraints, the adolescent ward rioted, and a doctor was sent to jail for molesting adolescent patients. Bellinger talked to a local reporter about the hospital and was fired the next day.
They didn't respond. If anything, they wanted to find out who was going to the news media exposing the practices of Charter Corporation.
Meanwhile, Charter Pembroke was being inspected by the Joint Commission on Accreditation of Healthcare Organizations, the only body in the country that accredits psychiatric hospitals. Dr. Dennis O'Leary is the Joint Commission's president.
In the last year, Charter Pembroke has had a riot. They've had a patient die in restraints. They've had a child psychiatrist convicted of molesting his patients. Charter didn't report any of this to its surveyors. How can the Joint Commission accredit a hospital that tries to keep that kind of information quiet?
If this information is brought to our attention, actually I believe you have brought this to our attention, I want to assure you that we will follow through on an active evaluation.
But wait a minute, you've got a hospital where there's a riot that takes place, where someone is killed, and where a child psychiatrist is convicted of molesting his patients, and you don't know anything about it?
The information has to be brought to our attention. Ed, we're not there all the time, every day.
But
They
this
need
was
to feel
in the,
free to come
I
to
mean,
us.
this isn't secret information. This was in the newspaper. It was on the internet. People who live there know about it. How can the Joint Commission, which is responsible for crediting this hospital, not know about it? Shouldn't you know about it?
Well, I think that we should know about it.
Then why didn't you?
Well, the information, as our information pathways need to be improved, but we also need to encourage people to know that they can come to us and share that information with us.
But it's so easy not to share that information. Under the law in most states, private psychiatric hospitals don't have to report a patient's death, even when that patient is a child who dies in restraints. And when the Joint Commission finds those cases, they don't normally disclose them to the public.
If a worried parent called the Joint Commission today to check on Charter Greensboro or Charter Pembroke, would they learn about the restraint deaths?
Probably not, unless those had been a matter of public record.
You wouldn't volunteer that information?
If the family said, was there a restraint death in this hospital, we would acknowledge that, yes.
But if they didn't ask, you wouldn't tell?
That's correct.
Charter isn't the only mental health system with serious problems. In the last 2.5 years, at least 32 patients have died while being restrained in facilities other than Charter.
Okay, as soon as we go, we're going. Okay.
Before he left Charter Pines, Terrence Johnson saw how dangerous it can be to restrain a child and how easily a child's injuries can be explained away. We'll show you what Terrence witnessed when we return. In the last year, we've looked at records or talked to employees from more than 20 charter hospitals around the country. Time and again, we found evidence of dangerous conditions, falsified records, and doctors who barely knew their patients.
Today's workout.
Justine Campbell was in her senior year at high school and hoping for a track scholarship when she was admitted to Charter Pines. Justine had attempted suicide. She says her doctor at Charter didn't really talk to her about it.
He'd tell me he had to go. He was in a real big hurry. He had other patients to see and was very, very busy, and he didn't exactly talk to me ever. I mean, I don't feel like he and I ever had a real conversation.
Justine's parents, Jeff and Jackie Campbell, soon got a call from a Charter psychiatrist, Dr. Ed Holscher. He hadn't seen or talked to Justine, but he'd already diagnosed her as manic depressive based on her suicide attempt and family history. He wanted to prescribe a drug for manic depression as soon as possible.
I said no. I didn't feel that he could die. I'd asked if he'd seen her, and he said he hadn't spoken to her yet. He was at his office. And he said that he really didn't need to see her.
He couldn't have spent enough time assessing the situation to make some of the statements he was making to me. I couldn't buy it.
Then Dr. Holscher dropped a bombshell. If the Campbells didn't agree to medicate their daughter soon, he might have to report them to the state. They could lose custody of Justine.
I mean, that's a parent's worst fear, is that someone's going to say you're being neglectful of your child or even abusing your child when what you're trying to do is protect them.
The Campbells stood their ground and had Dr. Holscher removed from Justine's case. She was back at home and back at school 8 days later. In the 8 weeks that Terrence Johnson worked at Charter Pines, he rarely saw any doctor spend longer than 10 minutes with a child.
How well did the doctors you saw seem to really know the children on that ward?
They didn't know their names. The relationship was almost non-existent. It was a matter of asking the child, well, how are you doing today? And going on to the next child.
It's just in and out, something about medication and leave.
Okay, I'll be seeing the rest of you just in 1 minute.
At the most 5 minutes.
I'll see you pretty soon, though. Okay, come on over here, please.
I just wanted to get out of there. Get me on medicine and get out of there.
This is also from your notes. Doctor woke patient up, spoke for 5 minutes. Doctor woke patient up?
Yeah, usually around 10 o'clock. The pre-adolescent kids, like 5, 6, and 7, they would be in the bed. And the doctor would wake them up.
Wake a kid up from a dead sleep?
From a dead sleep.
When lights out would hit and I'd be just getting down to go to bed, he'd come in. Oh, I'm sorry, I've been real busy. Let's just talk for a minute. And then out the door, I'm very busy. I don't have time for you, bye. And he'd be gone.
Or if you didn't wake him up, you didn't see him at all.
So it's like he'd try to see a patient and the patient will be asleep. And he just won't see the patient. And he just writes stuff in the book without seeing
He asks you.
Yeah.
Sometimes.
Or I see him copy.
And then he'll write down the time. That's not even the time.
Yeah, I know it's the same thing. Why did he do that?
On that?
Case in point, Dr. Holscher arrives one night when the children are already in bed, 10:05 p.m. He takes a quick look at a sleeping child and writes a note in the child's chart. Then he records the time as 2100 hours. That's 9 p.m., an hour before he arrived on the ward. Signed by Ed Holscher, M.D. We asked Dr. Holscher about his false chart entry, his late-night visits, and his treatment of Justine Campbell. His attorney sent us a letter denying these allegations and declining to discuss them, citing patient confidentiality.
I'll see you in the morning. Okay.
During the 8 weeks that Terrence Johnson was at Charter, he did see many employees spend time with the children and do their best to calm them down when they were agitated.
Just chill. We're listening to you.
And most of the time, Charter staff showed compassion for their problems.
Yeah, I can't let you beat your head, okay, bud? Chill.
But Terrence also saw what happened when the staff at Charter Pines got into situations they weren't trained to handle.
Did you ever see anyone get hurt during a restraint?
Yes. This kid was there for a number of weeks and was just seeking for somebody to talk to.
But this boy also had trouble staying calm, and he frequently needed the staff's attention for hours at a time.
What was the incident that led to him going into restraints?
He was bumping into the walls. He was bumping against the door. The mental health technician told him to stop. He wouldn't.
Experts have advised us that a restraint is a drastic measure, which should be used as a last resort. But when this boy kept disrupting the ward, a nurse decided to stop talking to him and restrain him to a bed.
So why did they want to restrain him?
He was taking up too much time, taking up too much manpower.
How do you do a restraint?
2 people to grab the arms and 2 people to grab the legs, and you sort of like rush the person.
Okay, as soon as we go, we're going. Okay. Don't hesitate. All right, okay. As soon as we know what we're going to grab, let's go get it. All right. All right, time to hold it.
People do not know how to do a restraint. So you just grab the person as best as you can. Oftentimes, they would be dragging a child, and they take you to the seclusion room. They lock your legs down, lock your arms into the restraint.
These kids are kicking and screaming a lot, huh?
Most of the times, these kids were not kicking and screaming. It was just a matter of just the staff just didn't know what they were doing.
At least one of the staff members here had been trained by charter, and yet no one seems to know quite how the restraints work.
How does it sit?
Were they ever afraid?
Were the staff ever afraid? Oh, yeah.
Oh, no, who?
You shutting the door?
He's here.
Oh, yeah.
He's getting
He got out. He got out.
Okay, that's fine, but he's still in there.
Relax. He's still in there. Lock
As
the
long as
door.
you're in there, that's fine.
Yeah. You all right?
Yeah.
Dr. Linda Fake and Dr. David Fassler are experts in how to restrain children safely. We showed them our tape of this restraint.
Now, once he's out of the restraints, we have a very potentially dangerous situation because now he's in a room out of control with something that he could potentially use to hurt himself.
This is not going to work. We can't see him. Can't have that.
And now they can't observe him. They don't know what he's doing in there.
That could be a dangerous situation.
It could be a deadly
Very
situation.
dangerous.
No, we can't let this happen.
Well, okay.
He's banging his head against the...
Yeah, that you can't let that continue.
And because he got enough.
But it did continue while the staff argued about what to do.
15, how long can we let this go? Why can't we just?
Can you make the argument, if you're the person running this unit, that this boy is disrupting the whole unit with his behavior, that it's better for the whole unit if he stays quiet all day?
Well, if this kid was brought here because he had problems that they were supposed to address, at what point were they going to address his problem? While I was there, he never had his problems addressed.
One of this boy's problems was an injured wrist, which was still healing when he came to charter. But no doctor or nurse ever notified the staff about his injury. And some staff members didn't seem to know about it when they restrained him again 1 week later.
Now, all you had to do was let go of my foot.
They're actually carrying him by his injured arm.
I mean, and he said all you had to do was let go of my arm.
That's right.
Can you just lay here? Let's do it. Come on.
It's really become a power struggle right from the very beginning.
And during the process of taking this kid to seclusion, grabbing him by his arms and grabbing him by his feet and legs, the kid's arm got hurt.
You know this ain't called for.
See, now he just grabbed that.
Yeah, this is very difficult to watch them tie down an injured arm.
Nope.
And the child's very clearly letting them know that that's painful.
You can hear him crying.
You're right.
What are you trying for?
Which one you have about second one? We need an order for this.
We can't say if this staff member knew the boy had an injured wrist before he restrained him. But here's what he said moments later.
He's complaining, he's complaining that I wrenched his arm down, that I hurt his arm. I was trying to get his wrist down, and he was forcing up, and when he tried to bite me, I just took his wrist all the way down.
Biting? Struggling? Look again at what Terrence Johnson recorded on tape.
Come on, settle down. You know this ain't called for.
He was struggling. I mean, and when he kneed me in the nuts, I almost let go of him, but he'd have pounded me then.
I like someone to look at his wrist. I think he needs some damage. Does it hurt?
You need to calm down and breathe, buddy. You got asthma. This isn't good for you, okay?
I think the staff are showing concern. They're showing that they realize he's in pain. They don't know what to do about it.
Right.
All right, I have to give you 2 injections.
They're going to give him another
They're
needle?
going to give him more medication.
But he's already calm.
Exactly.
Right.
Needed some pain.
Now he just appears groggy, which is very sad to see. He seems to have been heavily sedated. And when a child is that medicated, I start worrying about respirations, and I'm really also distressed by the physical injury that he had, and he was very clear that he was in severe pain. That seems very abusive. I mean, I would have to say that it's abusive behavior, not because they meant to abuse the child, but they weren't looking at a real physical problem.
These incidents and episodes that we saw should not be happening, and they shouldn't really be happening in any hospitals.
In his 8 weeks at Charter Pines, Terrence Johnson witnessed 8 restraints on 5 patients. We wrote to Charter executives and asked about their restraint policies. And they sent us a letter stating that Charter's policies are going to change. Our goal is to work toward a seclusion and restraint-free environment throughout the Charter system by the end of the year 2001. Over the next few months, extensive training will be implemented for clinical staff. Under this policy, seclusion or restraint would be limited only to extreme situations where all other methods of handling the situation have been exhausted. Just before Terrence Johnson left Charter, the hospital offered its first training classes in 7 months. Terrence signed up.
In the end, you finally did get some training.
Yes.
What were those classes like?
We were told that we were going to get a test, and these are the answers. The first question is true, and the class proceeded like that.
This Charter hospital where you work, do you think it's safe?
I think it's dangerous for the workers. I think it's dangerous for the patients who are there. These kids are being restrained by people who are not trained to do restraints. They're being left with mental health workers who don't know how to do CPR. Their vitals are being taken for some extreme medications by people who don't even know how to take vital signs.
Terrence, I've looked at the tapes that you've made, and I see people who honestly seem to be trying to do their jobs. Is it the people or is it the system?
These are nice people, you know, they're just workers. And they're caught up in a system that's aimed at money and not people.
So what does it cost to stay at a Charter hospital? The patients we met were charged more than $1,000 a day plus doctor's bills. Across the country, Charter took in about $730 million last year. About half of that was public money paid by taxpayers. We'll be back in a moment. Since we first aired this report in April, Charter has announced that it will close 2 of its hospitals, including Charter Pines, where Terrence Johnson worked with a hidden camera. Both hospitals failed surprise inspections by the Joint Commission, inspections which were prompted by our broadcast. Meanwhile, the federal government has notified 3 other Charter hospitals they may lose their Medicaid and Medicare funding, based on inspections conducted since our story aired. Just this week, Charter wrote us to say that the company has launched an internal investigation, fired and suspended several employees, and arranged for an independent review of its corporate policies and procedures. Charter's president expressed the hope that outside scrutiny will help the company improve its services and not eliminate an option for those who suffer from mental illness. Charter also sent us a list of what it claims are inaccuracies and falsehoods in this broadcast. We reviewed the allegations, and in every case, we stand by our story. We have posted the allegations and our rebuttals to them on our website, where you can read them exactly as they appear in our correspondence with Charter. Just go to CBS.com on the internet or use keyword CBS News on America Online. As for Terrence Johnson, he's back in Philadelphia working as a therapist and doing research at the University of Pennsylvania.
For news 24 hours a day, CBS.com on the internet.